Hello, hi, Olivia.
Hi,
Thank you for joining us today. How are you?
I'm all right, thank you.
Fantastic. So we're going to talk about your SCA and the recent SCA that you've passed. So firstly, congratulations.
Thank you very much.
So tell me a little bit about yourself, kind of how's training going and what are your plans going forward?
So I'm in my ST3 year of training. I'll be finishing in the next kind of 5 months, working in rural Wales. So I need to start thinking about jobs now.
Excellent, excellent. So let's kick off with the SCA experience. So talk me through your kind of general experience of preparing for the exam and the exam itself.
Okay, so I probably prepared for it over a period of about 3 months with a friend of mine. Who lived quite far away. We did it over Teams. Nobody in our training program had done the exam yet. We didn't really know what to expect. Neither of us had any experience of video consultations, really. So at the start, we were just cobbling things together and practicing scenarios together. And then at some point in the last 6 weeks, I think I signed up with you and realised that I was not as focused as I need to be, and it gave a lot more focus to kind of what we were trying to do. But essentially, all I did was endless practicing of cases with a friend, working on sort of specific skills at a time.
How did you find the challenge of not being used to kind of video consults? Because you said neither one of you were kind of used to video consults.
It's fine, although obviously when you're doing it with a friend, it's a bit different from doing it with an unknown person. And you kind of get so, oh gosh, I've dropped my ear thing. You get so used to looking at each other that you worry that you're not kind of concentrating properly on the person's facial expressions and things. But it's okay. But it needs a bit of stamina to sort of, it's different when you're on the phone. You don't have to worry so much about your facial expressions and things like that. I think making it through the whole exam, trying to, look focused and smiley all the time it requires quite a lot of stamina.
Yeah, no, absolutely. And how was the general experience of taking the exam? How did it compare to kind of what you were thinking kind of leading up to the exam?
The exam was fine in terms of it seemed very reflective of what we actually do. It felt like a very fair exam, hard, but obviously they always are. Um, it's
Mhm.
it is a bit of a marathon. It's a long morning or a long afternoon, and it's nice to be in the environment that you're used to. Um, Obviously, there can always be IT issues and things, and they did have problems identifying me, and there was no Wi-Fi in my surgery, so I couldn't send them through the things that they wanted, but they were very nice about it and very calming. And they said, we'll sort it out at the end, even if we don't get it sorted before your exam. So we did have to sort it out afterwards, but it went okay. And the cases were a lot more complex than I was expecting, but other than that, it was okay.
Excellent, excellent. And you did really well, so you've got through the other side and you can
Yeah,
put exams behind you for now.
yeah, yeah,
Good, good. Was there anything in particular? So you mentioned the complexity of the cases as
yeah.
one point, but was there anything else that kind of threw you off during the exam?
Yeah. So because there sort of aren't any, well, not that I'm aware of, there are not any kind of official mock cases as such, with the bit that you have to read, the case notes. So I didn't realize that the case notes can be really extensive. I'd only ever seen case notes that were kind of one page. So I actually
Hmm.
failed two parts of the second case in the morning because and the case felt very wrong to me, but I couldn't work out what was going wrong. And that kind of gave a leftover feeling of stress to me for the rest of the exam. So I ended up feeling like I failed the whole exam. And afterwards, when I read the notes that they give you, basically they said that I hadn't used any of the information I'd been given. So I hadn't realised at that point that you could scroll through the case notes and there was more than one page.
Makes sense.
Luckily, I realised that on a subsequent case because it was halfway through a sentence at the end of the first page, so it was obvious there was another page, whereas on the first one that hadn't
It
happened.
was another big friend.
Yeah, so I thought they'd just
Yeah,
given me really, because sometimes you do get cases with very little information, but actually there'd been a lot
absolutely. Yeah,
more and
yeah.
I just didn't know it was there, and that's why it had gone so badly because
Mm.
they said, why were you asking about the medication when it was all given to you and things like that.
Makes sense. Makes sense. So it seems
Yeah.
like the feedback's pretty impressive, isn't it? In terms of it seems very kind of specific to actually what's happened to you
Yeah,
in the
only
exam.
only if they don't give you any feedback for anything that you pass, just what you fail, but
Makes sense.
that's
Yeah.
fine.
So areas where you've kind of dropped off. Yeah, no, that makes sense. That makes sense. So in terms of preparation, so you said you were working with your friend and you were kind
Mm.
of running through cases together, um, and you talked about kind of the familiarity of, let's say, working with myself or working with the actor, whereas we were relative strangers to yourself at that
Yeah.
point, especially. Um, how did that compare in terms of when you were working with a friend to when you were working with a stranger? Was there a difference in the dynamic in terms of how you felt during the case? Was there a difference in the challenge? Do you feel that it was easier working with a friend or more difficult? Like, what's your general thoughts? Because actually, lots of trainees do work with colleagues as their kind of mainstay of revision for the exam.
Yeah, I mean, it was really helpful to do some cases with someone who wasn't just a friend. I still felt comfortable. Like, I felt that the environment of your course was sort of very supported, and um, it didn't, it didn't feel uncomfortable in any way to me, but helpful. Put me on my toes again, made me realize, how much further I had to go, not to get too settled and stuff like that.
I remember we talked quite a lot about kind of developing management plans and trying to kind of fit in kind of quite extensive management plans into a short space of time. And we talked quite a lot about kind of trying to move on at that 6 minute mark,
Mm-hmm.
trying to push in, trying to put the line under the data gathering and move on to the clinical management. I remember when we spoke after the exam, you mentioned that occasionally you were kind of going past that 6 minute mark because you felt that there was still quite a lot of data to gather. How was that transition from kind of going from data gathering to clinical management in the actual exam?
Um, a couple of times it was hard, but I feel like that was the most valuable thing that you taught me, was just get to that 6 minutes or before that 6 minutes and just make that diagnosis. Just go with it, and explain it really well. And then once you've done that, you've got the foundation of what you can do next, and it all follows very naturally. That's the hardest thing to do, and it's the hardest thing to admit to yourself that you have not necessarily been doing very well before, because we're all
Mm-hmm, mm-hmm.
doctors. We've all been
Makes
having
sense.
consultations for a long time, but thinking whether you really do stop
Yes.
halfway through your consultation and give a proper diagnosis and properly explain it at that point in time before going on to shared management, I don't think I really did that very well before.
It's quite difficult, isn't it? Especially when there's some degree of uncertainty. I remember when we practiced certain cases and we felt that an examination was necessary, that in actual fact you would want to bring the patient down, you would
Yeah.
want to examine them to give you the self that further reassurance that actually this is gout or this is possible Parkinson's from some of the cases that we practiced, or Parkinson's like, as that case was. Um, were there any scenarios where you felt that you needed to examine the patient, or was it fairly kind of built
I
purely around the telephone
Yeah, I
consultation
can't
model?
remember whether there were any where I needed to examine the patient, but they're pretty well set up that you do actually manage it all in the there. Yeah, there wasn't
Okay.
much of that, if any. I don't remember, I'm sorry.
Excellent, excellent.
Yeah.
No. We don't need to speak about specific cases, but it's interesting because it's very difficult to prepare. And I find when I work with trainees, especially early on, there is this tendency to want to examine the patient, even if there is enough information there. Whereas I
Yeah.
think as your confidence builds with doing telephone and video consultations, actually you feel that, we don't necessarily need to examine to make a diagnosis or give a possible diagnosis and then build a management plan around that. Did you feel that we challenged you enough when we were doing the course and we were working together in the coaching sessions?
Well, I mean, one thing that I found really good was you could pick me up from the level I was at and take me forward. So that's the thing that's kind of different from doing stuff as part of a group. You kind of have to go at the level of everybody. So in terms of like, you know, time efficiency and everything, that was great because you could kind of go, right, well, you basically covered taking the history, just we've got to move on from that before we even start. And it was good to do that and just go, right, this is where I need to focus. I do think that you challenged me, but the cases were still just more complex still in the exam. They're not impossible in any way, obviously, but just they're harder than anything I'd ever been shown. Yeah.
And one of the things that we did was, because you were in the January cohort, was when, you know, I received that feedback, actually they're more complicated or they're more nuanced, and we've started to make adjustments to the cases
Great.
to try and reflect that and make longer case notes and the longer candidate notes, because we appreciate that there's a lot more information there. The challenge that we had, and I don't know how you feel about this, is, you know, when you first start working with somebody, we try and make the cases maybe slightly easier,
Yeah.
because we don't want people to panic, and we just want to work on the, you know, can somebody take a history properly?
Yeah.
You know, can they take a focus history around a certain problem? Are they able to contextualize that from a psychosocial perspective? You know, how do they pick up on the ice? And then when
Yeah.
they've got all that information, how do you then implement it?
Yeah.
And it's really cool to see, because actually when you work through the transition and seeing, you know, how somebody is right at the beginning and what they're like at the end, it's really quite cool, because even for myself, it's like you can see exactly what you're trying to do, and you can follow your thought process when I was, you know, listening
So
to
I
you
didn't feel underprepared in
that's really
any
interesting.
way. I think having those like really solid skills is really important, as long as somebody knows that what they get in the exam could be a lot more. So even
It's
if
going
it
to be
was
fun.
just a couple of, because they take more time to, you know, and stuff as well to prepare. But as long as you know that there could be something with 7 pages of notes, or there could be a much more nuanced case, so that you're just not off put by it in the exam. There's always going to be surprises, aren't there?
Exactly that.
But I felt prepared. I didn't feel
Exactly that.
yeah. And getting used to being faced with so many
It's
notes
really
that you have
difficult.
to read is quite, you're quite scared about the time and how much detail you should actually read it, or do you just skim it, or what do you do?
Yeah. I guess it's very much like you said. It's very much like general practice, in the sense
Yeah.
that you're given so much information before a case. A lot of the time, a patient's like, "You don't know what I spoke to you about 3 weeks ago.
Yeah.
Do you not remember that consultation?" Or, you know, "Have you looked at my medical records? It's all there." So
Yeah.
yeah, you know,
So it's
it's
very
good that it's
fair. It's
replicated.
very
But
fair in that way. Yeah.
yeah, it's good, which is very good to hear. If you were to give advice to other people now preparing for the exam, you know, setting themselves up to either, you know, they're in their, let's say they're right at the beginning of their journey, what type of advice would you give to them?
So it is just like training for a running race or anything else. You've got to have like a dedicated period of time, but it can't take over your whole life. You still need to do the other things that you like doing and get enough sleep and all those kind of things, because it is quite a marathon and it's quite tiring. And you've got to kind of build up how many cases you practice with somebody, but obviously you're trying to fit that around work and everything. And to actually sit down and do a full exam is a very long period of time. So I think we only ever went as far as one of us doing 6 cases and then the other one doing 6 cases. So we knew what the whole exam felt like, but we'd only run half of it each. But getting to that point, you know, it takes a bit of time, it takes a bit of stamina, and having some structure around it is really good. Like, you know, going, right, first of all, we're just going to work on getting to the diagnosis, then we're going to work on giving a diagnosis and explaining it, and then shared management, which is it obviously is something we do, but I think you do it even more extensively in this exam than the way it's set up enables you to do it more extensively in this exam than you're necessarily used to. So you have to think about, you know, lots and lots of different management options.
I guess one of the things that you do in normal kind of practice is you use time as a tool. So you might do something initially like a blood test, and then bring them back, and then follow up from there. Whereas I guess it's the first contact with a patient. You don't have that kind of, You've not built
Yeah.
that relationship up with a patient already. So it's quite challenging, really, to do that in such a short space of time with all that information, and doing it on your very first consultation. So no, that's really helpful. You mentioned about kind of the balance of work life, preparing for an exam. If we use your example, you were still engaging with your rowing club. Is that
Yeah.
right?
Yeah.
From what I remember. How did you find that whole process? Because I remember one of the days we made some adjustments to the time so that you could still make your
Yeah.
rowing race, and I think your colleagues or your peers were really helpful that they waited for you so that you could get there on time.
Yeah, they waited on the beach for
How
me.
important do you think? Yes, yeah, I think we've overrun by a couple of minutes as well. Um, but kind of thinking back to that process, like how important is it that you do maintain that balance when preparing for an exam? Is it, what's the risk of becoming so focused that you let everything else slip in your life? Do you think there's a risk that comes with that?
Yeah, but I mean, there always is in medicine, isn't there? And I've done a lot more exams than a lot of people, having had like previous careers in medicine. So it's really hard, but it is really important because I think mentally this exam is quite tough. I mean, I did it over Christmas, have 3 kids on holiday. And you start to feel quite depressed if you're missing out on too much of what's going on at home and you're trying to keep up with everything. The rowing was really important to
Mm.
me, and one of the things I appreciated most about doing a course with you was the fact that you were flexible around what I could do, and even fitted me in really early that morning so that I could still go to that long training session. And that's something that you don't normally get as a trainee, sort of any flexibility in that way. So that was fantastic for me. Yeah, that's why I'm saying it's a bit like a running race or a rowing race or whatever else. You need to eat and sleep and have a bit of fun and take some exercise along the way, or you'll go crazy.
Absolutely, absolutely, and just try and stagger it out
Stagger it,
as you
and then
prepare.
and then
Thank you
also
very much, Olivia.
practice the actual exam room, like setting up your room and what it feels like and all that kind of stuff. Just the normal.
Yeah, yeah, no, absolutely. How did you find the whiteboard? Out of curiosity, kind of making notes. Did you feel that there was, or
Yeah.
did you make notes on the
No,
computer?
no, I used my whiteboard, and I had you're once you've been in the room and you've shown it to them and it's empty, then you're allowed to write on it. So I had my set patter that I had on it that I would just fill in the boxes for each case, and I'd leave my titles
Great,
there in between. So
great.
it was like, everything was like very sort of formulaic. So as much as possible about the exam I was already familiar with, and it felt comfortable. And I couldn't forget to ask about something because
Excellent.
it was on my board.
Excellent. Could you give us some examples before we finish as to what some of those
Well,
boxes were on your
written right
whiteboard?
in the middle of the whiteboard was diagnosis and explain. Um, and then there would be, yeah, so that like, and highlighted so that I was, and I knew I had to be there doing that at that time. I guess that was the biggest thing on my board,
Good.
but then around it, I'd have I put smoking and alcohol at the side because I sometimes forget to ask, or shared management,
Mhm.
just to just not a lot, but just the key things that I have to do. Yeah.
Just gentle props to that, to just remind you if you forget.
Yeah, and then if
Brilliant,
you suddenly
brilliant.
go
Thank you very
blank,
much for your
you
time,
can
Olivia.
look.
Absolutely, absolutely. Thank you very much for your time. I do appreciate taking your time out this morning to speak to us about your SCA preparation. I'm sure everyone who listens to this will find it extremely helpful.
Okay.
And thank you for trusting WellMedic with your SCA preparation. It was a pleasure to work with you, and I'm sure you're going to have a flourishing career as a GP once the portfolio is all done, and you get your CCT certificate later this year.
Thank you.